these therapies, chimeric antigen receptor T cells, have shown sort of unprecedented responses in patients with really poor prognosis. But obviously the unique mechanism of action is associated with unique toxicities. And as you just asked, neurotoxicity is one of them. The other is the cytokine release syndrome. So these are the two main sort of class effect toxicities. And we continue to learn more and more about these. And I think that, for example, neurotoxicity is the one issue with chimeric antigen receptor T cells that the pathophysiology is not completely clear. We're not 100% sure whether this is due to the T cells in the CSF, which we can see when we sample CSF from these patients, or whether it's due to the cytokine levels that are very high. And we know that the blood-brain barrier in patients undergoing CAR therapy and experiencing neurotoxicity is not perfect due to the endothelial activation. So again, the mechanisms will need to be better understood before we have really some effective therapies. I mean, at this time, in terms of the neurotoxicity, for the high-grade neurotoxicities, we do use generally steroids, which seem to be effective in a good amount of patients. But again, a better understanding of the treatment and the pathophysiology will be quite helpful. And we're working on it. We're trying to figure out the predictors of neurotoxicity in these patients. So far, we haven't been really that successful. There are some small studies suggesting that perhaps the tumor volume at the time of treatment, or the expansion kinetics, or even IL-6 levels on day first of the treatment could be sort of predictive of the neurotoxicity. But again, generally, when we look sort of at a larger number of patients and try to sort of sort these predictors out, we haven't been very successful.